Hi, Elizabeth. I am going to go through your exam. I'm going to go through some of your questions. We're going to start here with number one. With this patient here, the final diagnosis, which you did have, which is our D57.1, is our sickle cell without crisis disease. The thing that also that you coded was our symptoms. Okay. So when our symptoms are integral to the principal diagnosis, we do not code them. So here we only want to code the sickle cell disease. We do not want to code the abdominal pain, the swelling. So if you have any questions on that one, just shoot me a inbox. This one here, we have chronic blood loss anemia due to gastric ulcer. So let's go ahead and run through this one with the code. Okay, so our first code we want to go with here is going to be the gastric ulcer. So I'm going to go to ulcer, gastric, it says see ulcer, stomach. So in your code book, then you want to go to ulcer, subterm, stomach. And with this one, since we have the blood loss anemia, we are going to go with the hemorrhage. And you were correct with the chronic blood loss anemia. So you're just off a digit here with the ulcer code. Okay, this one, students, quite a few had wrong. With this one here, we want to make sure that the pain control due to the neck, your G89 codes are acceptable as principal diagnosis when pain control or pain management is the reason for admission. So make sure you look at the coding guideline, but our G code for the pain needs to be listed first. Okay, so when coding anemia in a neoplastic disease, there are two codes required with the anemia code listed first. This is false. Your neoplasm code needs to be listed first. And a lot of these, if you look at the rules in your textbook, you will see, exactly what you need for those. Okay, this one here, let's go ahead and just look up for our main term. Takes me a little bit here. My system's a little slow. Actually, it's a lot of slow. So once I type in, okay, so here we go. All of these are, we have destructive, okay? That is a non-essential modifier. It's in parentheses behind my main term. So destructive is there, diffuse is there, latenant's there. The only thing that is not there is ankle. Ankle would have to be in parentheses for us to use it. Let's go through the rest of your exam. This one here, we have bilateral vertigo. With this one here, let me know. Take a picture because I want to double check this one. And let me know if your code book has the 0.3. If it does, shoot me a text and I will give you a point for that one. Because my book does not. And I'll show you. I don't know. I had some students state it, but again, I need to see it in your textbook. I have just H81.4. All right, so the rest of everything looked great. You overall did a nice job. Let me know if you have any questions.